Hi, I'm Patti Casto. I've been a patient with Dr. Gardner since 2009, and I'm just here to give a testimonial on the services I've received at Dr. Gardner's office.
Okay, what first brought you to our office, Patti?
Well, originally, um, just teeth cleaning, things like that. At one point, though, I did come in about a year ago for a teeth cleaning, and um, my teeth were chipping, and I was surprised. I was having, so many chipped teeth. Crowns were chipping, my other teeth were chipping, and I really was trying to figure out what the problem was. And Dr. Gardner came in and during the teeth cleaning process, to give a kind of an exam, and he just really pretty much immediately talked to me about any headaches and things that, sore jaws and things like that. And we started putting two and two together, and he kind of came to the conclusion, I think, very quickly that it was probably having to do with my bite. And so we did sit down at some point and discussed, my options, and if I'd like to try some different procedures, and from there we started out with doing an orthotic appliance that they made fairly quickly, and next thing I knew I had this, it was kind of like a retainer, and it opened up my bite, and it was kind of interesting how quickly I realized that I had these low-grade headaches for about a year, and I was I really had shared with a neurologist these low-grade headaches because I had been seeing a neurologist because of some migraine headaches I had for my whole life, and we really couldn't get to the bottom of the low-grade headaches, and so I just pretty much lived with it. But it was very interesting how quickly Dr. Gardner zeroed in on that, and once the orthotic was in, it was immediate that my headache stopped, and I couldn't have been happier. And from there we realized that we had kind of hit upon something, and then he began this other process, so which involved a total restoration. So I don't know, do I?
How did, how long, so you had only been experiencing the headaches and the jaw pain, the headaches and the jaw pain, that was pretty much the symptoms that you were experiencing along with the chipping teeth, correct?
Probably not really the jaw. I really didn't have pain in the jaw unless I really had given up chewing gum. It was one of those things where if I chewed gum, I regretted it. Later on, it was not necessarily when I was chewing the gum, but later on after, maybe I'd be chewing gum for 20 minutes or something, and then I'd be done, and then, I'd suffer from this soreness. It was like, oh my gosh. So I just kind of just quit chewing gum. But I could definitely, if I chewed gum, I would have jaw pain. But having given that up, I was just suffering then with these 24-hour headaches. And like I said, they were low grade. It was weird. I could sleep with them. I didn't take any pain medication. I just essentially lived with it. I didn't know what it was, couldn't really figure it out. But
And how did it affect your overall life and the people around you?
well, I think the migraines had always affected my life. I really, my life really, I was very careful about planning my life because if one of the headaches occurred, it was so debilitating that I was down for 24 hours, if not 48. And so I was very careful, and had been since I was in the 3rd grade, and now I'm almost a senior citizen. So it had been a lifetime of just having to be very careful. But the low-grade headaches, again, I think I just have a pretty high pain threshold, and I just really am not a complainer. I I really didn't let those interfere. I just went on with life, and I tend to be, I tend to distract myself. I became very, very busy.
Mm-hmm.
I didn't, if I stopped, then I realized the headaches more. And so I became very overactive even to try and postpone them, I guess, or distract myself from them. So it was interesting. It drove everyone crazy. I couldn't sit in cars for very long because I couldn't just be driving down the road in a very on a long road trip or anything. Everything had to be short, fast, and it drove a lot of people crazy, including myself. So it was weird. It sounds, it was just, I have a tendency to just, make do. And I just assumed that there was nothing could be done until I met Dr. Gardner. So.
And what motivated you to receive this treatment from Dr. Gardner?
Well, I think for me, I was just very, I really, to be honest with you, I didn't really have a lot of faith in the headaches being fixed. I really didn't. I think I just had resigned myself that this is just, what it was. I just couldn't believe it was related to a bite. I really didn't. But the confidence in Dr. Gardner was, and the fact that the man keeps up with the education like he does. I mean, and I just had this enormous faith in him for, I don't know why, but he just comes across and, very confident, and I just felt that he might be on to something, and so it was kind of funny because once I, made, kind of talked it over with my husband. I think my husband was my biggest fan, and Dr. Gardner even, he was one of Dr. Gardner's bigger fans, and I think we just kind of, once I brought it up, it was like a done deal. We were going to do this no matter what. Why not? And I just was ready to fix this mess, and if somebody was willing to attempt it, then I thought I should be willing to let that person do it. I really had, I think in my mind, just thought I was a lost cause, and Dr. Gardner was just so, like, hey, you're nothing compared to what, is out there, as far as, your mouth is going to be easy. And I was like, oh, okay, I'm in then, because he just made me feel like I was important, I guess, enough to fix, so.
And describe your experience in the treatment process that you received.
Again, once that orthotic went in, it was instantaneous that those headaches stopped. Instantaneous. It was weird. It was really quite fast when it was all said and done. I couldn't believe how fast it went from, the orthotic I would probably had the longest, just to try and open my bite because, again, I'm not young, and this had been going on for a long time. I'd had a lot of dental work. Just about every tooth in my head had been, crowned and root canaled, and, I had 3 implants that had been done. I had seen, we've traveled all of our lives and been in different states, so I'd seen multiple dentists, so you could imagine the mess that was in there. And I just couldn't believe once the orthotic went in, I had that for I want to say probably 3 or 4 months, maybe. I don't know why I think that. That seemed to be the longest process. And once the bite was opened up, it was fast. I mean, I came in here one day, everything was ground down, new temporaries we put on, and I was out the door. It was bizarre, and that's how fast it was. And then, you don't have the temporaries for very long, and then it seemed to maybe 3 weeks, and next thing I knew, I had the the real thing was being placed. All the teeth were being crowned, or veneers, I think, were put on, and so it was fast. It was exciting, and so yeah, I was ready for our daughter's wedding, which was our goal, and so my husband has had the same treatment for different reasons, but so we all, at the wedding day, we all had beautiful teeth, so it was a lot of fun. So yeah.
And how has this process and this treatment that you've received changed your life?
I think it's really, I've been able to kind of slow down, to be honest with you. I'm much more relaxed. I'm not, just a hyper mess because of, I can actually relax and sit and watch TV. I can sew, which is one of my loves, and I'm not having to find distractions. I can listen to people. I can be on the telephone, and I'm just much more relaxed. It's we can plan things and do things, and I'm not worried about the fact that I'm going to get some wild and crazy headache in the middle of all of it, or just have this constant headache, and so I think it's helped me relax, and I think our family everybody's relaxing around me. It was it was getting to be just a very stressful lifestyle, to be honest with you. So yeah, I think I'm better. I'm healthier. I'm just different attitude. I feel good. Just everything is looks better. To me, I'm just happier. So yeah.
And what would you say to potential, future candidates that Dr. Gardner would have for this treatment?
I think trust Dr. Gardner. I think I think I've just never met a dentist that is so focused, on the patient, and so aware of the needs of the patient. I think it's interesting that he you can just feel that he has such a love for this field, and he just wants to know everything, and he wants to make sure everything is so perfect. And I think so many times I'm kind of ready to, I think it's perfect, and he says, no, we can make it better. And I just have faith in Dr. Gardner. I think you'll, and know that you're in really good hands, and they want nothing but the best for you, and they'll go to, oh my gosh, I can't believe the lengths they go to, and the time they spend with, spent with me, and I know they spent with my husband during his treatment, and they never make you feel like you're, that they don't have time for you. It's when you're in that chair, it's all about you, and I think it's important, if you're not happy with your smile, or you're having problems with pain and such, give them a chance to help you, and I think you'll just be shocked at how quickly they can relieve your pain and any discomfort you might be having.